When women come to me for anything gynecologic and they're telling me they're thinking of having a baby down the road, let's think about this as a 3 to 6 month window before where you really are optimizing your nutrition. You're not waiting till you're pregnant to get enough choline for your baby's brain. You're doing that now. You're not waiting until you're pregnant to find out you're anemic. You're making sure that your iron status is healthy now because that's good for you too, right? You're going to think more clearly, have more energy, all the things. So the list goes on for me. It's like really optimizing to a low inflammation, nutrient dense, plant-based diet, but not necessarily vegetarian. Vegetarian's fine. You just need to make sure you're getting enough quality protein and not living on carbs, reducing environmental exposures, making sure that you are getting things like your vitamin D level checked, your hemoglobin and hematocrit. So you really are intentionally supporting your nutrition levels. And then if your cycles aren't healthy or treating you well, then making sure that you're really looking at, are you ovulating? Are you having heavy clots? Are you having a lot of mood symptoms? Is there signs of low progesterone? Make sure your thyroid is healthy, almost like an executive physical, but it's a preconception, physical and workup and just teeing everything up a little bit.
Aviva Romm is a world-renowned midwife and herbalist who also happens to be a Yale-trained medical doctor and board-certified family physician with specialties in integrative gynecology, obstetrics, and pediatrics. A longtime home birth pioneer and birth activist, Dr. Romm is keenly committed to patient empowerment and addressing health inequality, racism, sexism, and other biases in medicine, particularly in women's and maternal health. She is the author of the textbook Botanical Medicine for Women's Health, and her latest book, Hormone Intelligence, was an instant New York Times bestseller, which explores the intersection of the world we live in and women's hormones and health, inviting women into a whole new conversation about our hormones, bodies, and health. She practices medicine in both New York and Massachusetts, and she lives in the Berkshires of Western Massachusetts. She also is the mother of 4 and grandmother of 2 that she has had the privilege to midwife into this world. Welcome, Dr. Aviva Romm. I'm so excited to have you on Take Back Your Health with Dr. Amy Myers. Welcome back to Take Back Your Health with Dr. Amy Myers. I am so excited to welcome Dr. Aviva Romm as this week's guest. Welcome, Aviva. How are you?
I'm doing great. It's so good to be with you again. It's been a minute.
Well, you are a fellow colleague and MD, but you have a very interesting background as a midwife. Would you like to kind of quickly tell us your story and how you got into functional medicine?
I was going to college really early. People jokingly say I was the original Doogie Howser because it was before Doogie, who I've never seen. But I was 15, off to college to study medicine, and very quickly got exposed to home birth midwifery and herbal medicine and was like, oh, there's a whole other world out there. So spent the next many years out of school, out of the box, apprenticing, studying, practicing. And as part of that, actually, functional medicine came into my life. I was the president of an organization called the American Herbalist Guild for a decade. And one of our members was Dr. Robert Roundtree, who's one of the founding members of the Institute for Functional Medicine and one of the original textbook writers. Bob and I go way back. We're dear friends. And so at some point, very early on, before the book was released, he said, hey, will you have a look at this manuscript? Tell me what you think, give some feedback. And that was just kind of an entree for me into a really interesting intersection. I think I had actually just started medical school. So I was a home birth midwife and an herbalist for almost 20 years, then became an MD, and I was at Yale. And I think that was when I got the copy of the manuscript very early on in my training. And I was like, this is kind of a missing link. There's a lot about functional medicine that I actually honestly don't abide by. I feel like there's a lot of testing, a lot of oversupplementation. But what I do find is 2 things. It provides a really important bridge between what's happening in the integrative world and what's happening in conventional medicine in terms of like a language that connects the 2. And within that allows us to step back and say, okay, somebody has like in conventional medicine, somebody has diabetes, they get diagnosed, and it's like the doctor acts like the disease just started that day. Or they just basically blame the patient, right? Like they're like, it's your fault. They don't maybe say that directly, but maybe they do, but like you're overweight, you eat badly, la, 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 la. Whereas with functional medicine, it's like, okay, we need to reframe this. Yes, diabetes is a real medical condition. We're not just going to say that doesn't exist and take some herbs and supplements. It's real. We're going to acknowledge it, but we're also going to say, let's look at the whole ecosystem that this person is living in and what led to this, right? Is it genetics? Is it mitochondrial function? Is it detoxification issues? Is it diet? Is it all the things? And I really loved that. And it also, unlike so much of just general integrative medicine, which of course I practice also, integrative medicine is a little more, I call it kind of like smorgasbord medicine. You pick a little of this, like you do a little herbs, you do a little mindfulness, you do a little this, but there's not really an architecture. Whereas functional medicine, I feel like has the matrix. It has the timeline. There are models to think through how we're approaching a patient's situation and condition. So for me, going from being a home birth midwife, which is very woman-centered, very much looking at the whole ecosystem a woman lives in, it was a real natural kind of bridge for me to bring all the different parts of myself together, and then ultimately as a physician.
And so how was that for you when you, I guess, what was your residency in?
So my internship was in internal medicine. I actually spent a year at Yale doing internal medicine. And in that year, I found myself spending a lot of time increasingly frustrated with how sick people already were. And it really didn't incorporate any pediatrics, any perinatal health. And so I felt like all my years as a midwife weren't really being utilized to the best of their capacity. And I actually have a dear friend who's a physician. He's a pediatric cardiologist. And I was saying, hey, I just feel like everyone's already like they're in the ICU. They've got years and decades of accumulated problems. He said, internal medicine is a little bit like rearranging the deck chairs on the Titanic. And while I loved internal medicine because it's very intellectual, it's very much like medical detective work. So I had that year, and then I shifted into family medicine, which is where I did my residency, because that allowed me the full scope, right? So as a family doctor, I treat everyone, basically we say cradle to the grave. So I do pediatrics, I do obstetrics, I do gynecology, and I do all of the things I did in internal medicine.
As many people that are our colleagues went into medicine and later found functional medicine and then, shifted their mindset. You and I went into medical school with this idea that I would do functional medicine. I actually spent a month with Andrew Weil, my fourth year medical student, doing integrative medicine. And I too was just like, okay, I'm just picking this stuff, but there's not a framework. I just feel like I'm farming people out, but I wasn't actually solving their problems. So that wasn't the fit for me. So for me, as I was going through as much medical school, but certainly residency, knowing that I wanted to practice how I did ultimately practice, it was so hard, just feeling like, the long hours and the overnight shifts and just feeling like, of course I was doing emergency medicine. So there were things that were critical and it is a part of conventional medicine I could believe in.
I think that had I not had all the background I had already 20 years going into it of doing all this work. So for me, the transition was really wonderful in terms of I was putting this big foundation of science and information under all the things that I had been doing with good evidence, but it was like a whole other foundation for me. But then it also gave me permission to bring everything I was doing into a much wider sphere, much more legitimized. So one hilarious story is that I had given a class to my residency team on varicosities. And I talked about horse chestnut along with compression stockings and all the things, right? So about 3 months later, one of my attendings who was precepting me caught me in the hallway. He said, "Hey, Aviva, you know that horse chestnut stuff you were talking about?" He said, "Do you think it would work for a 300-pound male diabetic with severe varicosities?" And I was like, that may be pushing it a little. He said, "Yeah, actually, I started my patient on it right after that class that day, and he is getting massive improvements." And I was like, okay. So that part was amazing. There was so much welcomeness. And actually, my residency site was one of the model sites for the Andy Wiles University of Arizona Integrative Medicine Residency certification. So I was actually a faculty in it while taking it at the same time. So the support for me doing all of that was phenomenal. The long hours, to some extent, I had already been a midwife for 20 years. So that wasn't the killer part. But the really hard part was, I would say, having 4 kids at home while I was trying to do it. I had 3 teen and tween daughters and a son who was just starting college. And there were certain aspects of particularly obstetrics, having been a midwife, that I found really challenging, like just the unnecessary interventions and sometimes verbal, emotional mistreatment of patients that I saw happening in general. Racism, things like that were very hard to deal with. And you're in a system where, you can say things, but you also have to be really careful because you could very easily lose your job.
Right. It's a hierarchy. Well, that's the perfect segue. What we're going to be talking about today is really, fertility, preconception, conception, and then all the way up to birth. So all the things that you love, and let's dive in. So when we talk about fertility and whether someone's fertile or not, what really is?
Yeah. So there actually are very standard definitions for what defines fertility or not fertility. And for anyone who is under 35 years old, if they have actively tried to conceive for a year and have not conceived during that time, that is grounds for an infertility workup. That's considered cause for concern. And 35 and over, if you've tried for 6 months and haven't conceived, that is considered grounds for concern. It doesn't mean you have infertility. It may mean you have what I would prefer to call subfertility. You need a little bit of help here. You're just not getting pregnant quite as easily. Infertility is also different than being sterile. So sterile, like you don't have eggs, you don't have ova, or there's something, or your partner doesn't have sperm. There's something getting in the way of you getting pregnant that cannot be fixed. But infertility usually implies one of the many reasons, and it can be something going on with your fallopian tubes. It can be something going on with your uterus. It can be something going on, you're not ovulating. It can be nutritional, immunologic. There can be immunologic issues that a woman is producing antibodies against sperm. Half the time, we don't even know what's causing it. And 50% of the time, it's not actually a female problem. It's a male. Essentially, 30% of the time, infertility is unknown causes. And half the time, it's actually going on with the sperm or something going on with the male partner, not the female partner.
Wow, very interesting. So not that, but I've been in that boat, and you kind of feel like it's my fault or it's my body. So, 20% of it is really, potentially something with those statistics. So let's see, you said 30% is we don't know, and 50% is men. So that's 80%. So 20% is potentially something.
Well, it could be of that 30% that's unknown. It could be all female, or so pretty much half and half, male, female. And then within that, there's some percent for each that is unknown. And I think the unknown part is really interesting. And this kind of gets us back to functional and integrative approaches. And I think that even the known parts are interesting. So again, it's like you get this diagnosis of a fertility problem, and then you get the $1 million workup, which not necessarily $1 million, but can be thousands and thousands of dollars. And it may tell you what's going on, but it doesn't necessarily tell you why it's going on and what you can do about it. It's more like, this is broken, here's how we fix it, as opposed to, and that's fine too. Like that may be the answer somebody wants, but it's not like, here's what's happening. You're not ovulating. What are the reasons for that? You have inflammation in your uterus. What are the reasons for that? And so on. Or in that unknown picture, that whole box of like, we don't know what's causing this. There's very little exploration of, well, what are the things that conventional fertility medicine and gynecology don't know that we actually do know in an integrative or functional medicine perspective that could help a lot of women who aren't getting that information.
Certainly, it seems to be seemingly all over the news that fertility or infertility is really on the rise. My first is that true? Or are we just getting better at, sort of diagnosing that, or are people just waiting longer? And then if so, Do you have your thoughts on reasons why this is happening?
Yeah. So I want to just, if you don't mind, just jump back to what you said before about feeling like it's all your fault. And I just want to really emphasize, and Amy, I know you share this view as well, that there are so many complex factors that go into why we experience the things that we do in our bodies. So a fertility challenge is no more your fault than a mental health problem or a thyroid problem or an autoimmune disease. We are all the canaries in the coal mine of the world we live in, including the foods we had no choice over when we were little, the million rounds of antibiotics we got, the environmental toxins that we got exposed to, the lifelong stressors that we've had. And women are especially vulnerable to these. So I think it's so important for us to have grace. And I just want to acknowledge that even though I'm talking about integrative and functional approaches, I honor all the realm of approaches, to the most advanced assisted reproductive technology, to surrogacy, all of it. To your question about whether the rates are going up or whether we have better diagnosis, I think the answer is yes and yes. The rates do seem to have gone up some. We do have better diagnosis, and we also have tightened the criteria around which we diagnose. It's complicated by the fact that the fertility industry is becoming a multi-billion-dollar industry. So I have a dear friend who was 34. She had been trying to get pregnant for about 6 months. She went to her gynecologist in New York City, who told her that her eggs were like a fried, it was in August when she went. If anyone's ever been to New York in August, it's really hot. Yeah. And she said her eggs were like a fried egg on the sidewalk in Manhattan. And she was never going to get pregnant on her own. And a few months later, she actually did get pregnant on her own. So, there's a lot of push in the fertility industry to get women in that kind of on that conveyor belt. So it's important that we have those options. And also it's important to recognize that that may not always be the first place to go. But back to why the rates may actually inherently be rising. We do know that male sperm count and male sperm health has gone down. And we know that so many factors can contribute to that, just like they can contribute to ovulatory health in women. So nutrition, nutritional insufficiencies, low zinc, low vitamin D, insulin resistance, chronic inflammation, chronic stress. Interestingly, we also know, and this is kind of something that's not talked about, I think, as much, that young people, so people in their 20s and 30s who are in that age range of trying to conceive kind of, typically are having sex less. So it's not just that their fertility rates have gone down, but we know that they're having sex less than older adults or than adults our age were when we were in our 20s and 30s. And largely it's due to screen time in the bedroom.
And then you have to worry about the EMFs too, right? Carrying your cell phones in your pockets and all those things.
So there are a lot of reasons. Alcohol intake, which we know went up during COVID. And that's another thing is we're seeing some of this data that's rolling out now that is data that was gathered during COVID. So various things that people are commenting on. I did an interview with Lisa D'Amour on teenage mental health problems. And there's been a lot of data coming out for a long time that teenage mental health problems are getting worse. But then we know that they got much, much worse during the pandemic. So, teasing out, we know that women's alcohol rates are up right now, and it's really problematic. But that started during the pandemic. So teasing out some of the data now and then reevaluating in 2 or 3 years may also show us a slightly leveled out picture. It's a little unclear at the moment.
And, your story about your friend just reminded me of several people that I know, and kind of curious your take on this, that were told they couldn't get pregnant. So they adopted or they went through, fertility treatments, and then, might have adopted a child or might have conceived through IVF, but then later got pregnant, spontaneously, so to speak, because they thought they couldn't get pregnant just naturally. So what are your thoughts on what's happening there?
Yes. I have prescribed the vacation fertility treatment more than once and successfully, actually. I had one couple that came to me when I was working at the Ultra Wellness Center, which cost a pretty penny to come to as a patient at the end of the day. Yes, I gave her nutritional recommendations and I gave him nutritional recommendations and supplement protocol, but they were about to go through adoption proceedings to start them. And they went on a vacation to the Caribbean and came back pregnant. So go figure. Sometimes it's just stepping out of the stress. Sometimes it's, learning more about your cycle and having sex when you're fertile. But sometimes it's throwing away the thermometer and all the things and just getting back to juicy sex life, But yes, I think that we do know, for example, that waiting long enough, and this is back to sort of that push to get on the fertility treatment conveyor belt. Most people who wait 2 years will get pregnant. Statistically, most people who wait 2 years will get pregnant, especially if they're under 35. As you get over 35, that number starts to go down a bit, but the statistics are still really good. That the odds are really good that you will get pregnant in that 2 years if you tried diligently and wait long enough. The problem is if you're 36 or 37 or 38, the idea of waiting 2 years to first start fertility treatment is also daunting. So I usually do recommend going through testing if you do decide you want to wait longer. We also know that people who do go through a pregnancy, even if it took them longer to get pregnant, or who go through a pregnancy with any kind of assisted reproductive support, will much more likely get pregnant spontaneously with a subsequent pregnancy. So that's interesting too. You have somebody who's got a 1-year-old, they weren't planning to have another baby for a while. They figured they'd have to go through the whole fertility process again. They assume they're not going to get pregnant, and then they get pregnant spontaneously with a 1-year-old that they did not have.
Right.
So
how can someone know what their fertility status is? Is there a sort of standard workup, and does that differ from a functional medicine workup?
So I would say the most important thing, you can't get fertile. You can't get pregnant if you don't ovulate. So knowing whether you're ovulating is probably the most important thing. And that's something that we can figure out at home on our own. There are ovulation test kits. There are basal body thermometers. There are tests that let you look at your saliva to see whether you have a pattern that indicates fertility. You can check your cervical mucus at home. There's so many things that we can do. And if you are ovulating and you're still not getting pregnant, then next level workups are important. There could be blockages in your fallopian tubes. Maybe you had scarring for some reason, or there's inflammation. There can be a whole host of other problems. If you're not ovulating, then you kind of take a step back and have to look at, well, why is this person not ovulating? Are they undernourished? Like low body weight can cause someone to not ovulate. That's called hypothalamic amenorrhea. Over-exercise and low body weight. We see this in athletes all the time. Thyroid problems can cause you to not ovulate. Even just having elevated thyroid antibodies can actually get in the way of fertility. There are so many things that can get in the way and one of the big ones is something called polycystic ovary syndrome that women can treat effectively, but often the diagnosis goes missed for years. Sometimes women only get diagnosed when they do find out they're having a fertility problem. And then endometriosis is another common cause of challenges getting pregnant. And again, another diagnosis that women can go years, they can go a decade without getting a proper diagnosis. So really becoming an advocate for yourself to get a good workup is important. I would say the difference between how I approach a fertility workup and how a conventional physician would approach a fertility workup is I probably start a little earlier. If somebody's 35 and they haven't gotten pregnant and they've been trying for 4 months and they're coming to me for fertility, I will say, hey, yes, keep trying. And I'm not going to diagnose this as infertility by any means. But let's make sure everything is optimized, right? Because so many women go into pregnant with thyroid problems, with PCOS, with low nutritional status. So why not use this as an opportunity to optimize and make sure everything is okay? And then I would say, based on the fertility workups that I've seen, I'm probably just a little bit more comprehensive, as I'm sure you did in your medical practice, Amy. I check a much more comprehensive thyroid panel. I just don't check a TSH. I look for antibodies. I look for free T3, free T4. I'm going to look at what's cortisol doing. I'm going to look at insulin resistance and other factors that we know that aren't necessarily always on the first level of a workup with a conventional doctor. And I'm very against over testing, but I feel like these are really important panels that we can get done that can give us a lot of information that can help a woman achieve her goal of getting pregnant without having to do some of these next step $1 million and more invasive workups.
Well, before we move on to preconception, what are your thoughts about, a woman who isn't ready to get pregnant, but knows that she's sort of at that, 34, 35 range. Maybe she doesn't want to be a single mother. She doesn't have, a partner, right now, about freezing your eggs. Yeah.
I think that freezing eggs is a very legitimate choice if somebody is experiencing that uncertainty, that anxiety, that stress, that feeling their biological clock is ticking. They don't have a partner. They don't want to have a partner just to have a baby. And they're not ready yet. It's a great, viable option. There are things to consider. It's costly. And it's not just the cost of the medications and the egg retrieval. There's maintaining the eggs over time. So there's a banking cost. There can be side effects and risks with the hormones. You can do a natural cycle harvest, but you're going to get much fewer eggs. So now you're going through a procedure for lower yield. So doing the hormones makes sense, but it can put you pretty out of whack for a long time. And then what a lot of people don't know is that there haven't been that many frozen eggs that have successfully been implanted and become babies. So the data is pretty good on the safety of it. We don't have significant long-term data on the well-being of those children, but the initial data suggests it's pretty good. But the success rate is actually fairly low. So, you wait, and then you get these eggs that you're depending on, and they may not be reliable. So that's just something to keep in mind as well.
Mm-hmm. I mean, my understanding is, as an embryo, they are more stable than as an egg, but then, you're taking, obviously, then if you do, particularly if you're a female and meet a male partner, that then, you likely would want to have that male partner
involved.
Yeah, right.
Yes. And it's complicated. I have a patient just this past year who I worked with who has a couple of kids, had several miscarriages, so went through the whole egg retrieval and then had embryos with her partner, and then realized that she was just kind of exhausted and felt a tremendous amount of guilt for not using the embryos.
Mm-hmm.
And so that was a whole level I hadn't really seen before.
Right. And then what do you do with the embryos? Or do you donate the embryos to somebody else? Do you destroy the embryos?
There are ethical and personal complexities to all of it.
Someone's ready to conceive. They've done their fertility workup. Seems like things are good. What should they begin to consider from a diet standpoint? How do you get somebody ready for preconception? Because I don't think people think about that, right? I mean, they think I'm ready to get pregnant and they go get pregnant. And it's very few people that are thinking about it. Only the people who, at least in my experience in my clinic, that are having the problems and they find you, they find to me, then we're talking to them about nutritional status or maybe detox and these things. Whereas, someone who isn't going to have difficulty conceiving, very few people think beyond the prenatal vitamin, right?
Absolutely. So I think about it this way. 50% of all pregnancies in the US are unplanned, including in women in their late 30s, early 40s, mid 40s. So in some ways, ideally, we would all be gently, lightly treating ourselves as if the possibility existed that we could become pregnant and maybe want to be pregnant at that time. So, I think about it from this sort of global 30,000 foot view of what things would we want to avoid if we're pregnant. And if we want to avoid them because we're pregnant, maybe they're not optimal for our gynecologic health anyway. And I'm not so much talking about alcohol, although yes, that too, but I'm more thinking about body products that may be really significantly impacting our estrogen, or BPS in our water bottles, or Teflon, derivatives, PFAS and other derivatives coming off of our nonstick pans, right? And not that people have to go crazy and be purist, but what are some of the big things that we can do now for our gynecologic health that will make us have easier conceptions and healthier pregnancies? But in the least, when women come to me for anything gynecologic and they're telling me they're thinking of having a baby down the road, I'm like, let's think about this as a 3 to 6 month window before, where you really are optimizing your nutrition. You're not waiting till you're pregnant to get enough choline for your baby's brain. You're doing that now. You're not waiting until you're pregnant to find out you're anemic. You're making sure that your iron status is healthy now because that's good for you too, right? You're going to think more clearly, have more energy, all the things. Let's look at if you have a history of PCOS, how do we get your metabolism and your blood sugar, and all women, so many women have blood sugar problems, really dialed in, because we know that women who have blood sugar problems before pregnancy, and especially if they have PCOS, have much higher rates of developing gestational diabetes and diabetes later on. So the list goes on for me. It's like really optimizing to a low inflammation, nutrient dense, plant-based diet, but not necessarily vegetarian. Vegetarian's fine. You just need to make sure you're getting enough good quality protein and not living on carbs. And if you are getting carbs, they're healthy carbs. A lot of people, and I was a vegetarian for a very long time, including through 3 of my pregnancies, you can do it well. But if you're not getting enough good protein, you tend to lean toward carbs and quick foods because you're hungry, and they're like healthy carbs, but how healthy are rice cakes, even if they're brown rice cakes at the end of the day? Right. Again, reducing environmental exposures, making sure that you are getting things like your vitamin D level checked, your hemoglobin and hematocrit. So you really are, intentionally supporting your nutrition levels. And then if your cycles aren't healthy or, treating you well, then making sure that you're really looking at, are you ovulating? Are you having heavy clots? Are you having a lot of mood symptoms? Is there signs of low progesterone? Make sure your thyroid is healthy. Kind of all the things, Amy. It's like almost like an executive physical, but it's a preconception, physical and workup, and just teeing everything up a little bit.
And where do you stand on detox, right? Because you want to detox well before, and I'm curious to know from you what that time frame is, because, they say the quickest way to detox, this is the joke that I've heard in functional medicine, is to get pregnant because it's all going to go to your baby. So I love all the things that you said, but coming, a person who doesn't detox well, that's one of the things I think about is how, it's something I would want to do is really detox before getting pregnant. What are your thoughts on that?
So it's a really interesting question. I have like 5 podcast series on detoxification because it's such a big question I get. And I would say if you had asked me like 20 years ago, do people need to detox before they get pregnant? I would have said, no, leave your body to its own devices, eat well, your body knows what to do. And I pretty much stand by the same thing. But given the fact that there are 80,000 plus environmental toxins, we know that we all have forever chemicals in us, and we do know some of the joke about the quickest way to detox is to get pregnant comes from the fact that back in like the kind of early industrial times, when women worked around heavy metals, particularly it was observed that women who had exposure to lead had a line in their gums, a black line in their gums. And when they gave birth, they no longer had the black line. But the baby had the lead. So it directly transmitted to the baby. So that's this whole idea, mom detoxes by baby getting it. It's probably not that extreme with most things. But we do know from studies done by the Environmental Working Group and studies that have been those studies have been corroborated by other high-level laboratories that newborns are born with almost 400 environmental chemicals already found in their cord blood, right? You can test the cord blood at birth and we see it. So I think about detoxification not as you have to do a detox. And in general, I don't promote heavy detoxes. I think they're often very depleting. But what we do want to think about are what are the things that we can add in that deeply support our body's detoxification functions? So abundant leafy greens, berries, a wide variety of brightly colored fruits and vegetables. When we think about quercetin, it's a wonderful agent that can be used for a plant-based supplement that can be used, but we can get it in onions and we can get it in apples. We think about antioxidants, and yes, you can take NAC and you can take glutathione, you can take all the things, but you can also eat a cup of blueberries every day, or organic frozen or fresh blueberries. You can get your leafy greens steamed every day. And then we can think about it. Walnuts are phenomenal for detoxification, almonds. So really having that wealth of healthy plant-based foods in our diets, and then avoiding the things that are adding, that are compounding the body burden that we carry of all of those environmental chemicals. And then toward that, making sure that you have good elimination. I mean, the primary ways that we eliminate environmental exposures are through our skin, our breathing, our urine, and our stool. And so we can't really so much control what's coming out of our breathing and our skin, but people do have skin problems. That can be an indication that something's going on. But we can make sure that we're getting plenty of fiber in our diet, which helps absorb those toxins in our body and eliminate them, and making sure that we're having a regular, ideally healthy daily bowel movement. The other thing, and I haven't mentioned this, is organic food. Studies have looked at what happens when we do what's called a washout period with food. So, for example, there was one famous study done in the Pacific Northwest looking at children who were eating a conventional diet. Their blood levels were measured and found to be filled with environmental toxins, primarily agricultural chemicals, herbicides, and pesticides. And then they were given a washout period. I think in that study, it was like 3 days or 5 days. It wasn't even that long. Put on organic foods during that time period, had all those conventionally prepared foods removed. And it was a dramatic difference between before and after. So we know that just changing our diets and going more organic can make a difference. And I recognize that this is expensive for a lot of people. There are places like Walmart that are doing a phenomenal job doing bulk purchasing and make organics affordable. Mm-hmm. And you can buy frozen organic foods, sometimes like frozen berries instead of fresh. They tend to be less expensive. But also think about the really big food groups. Like if you're getting meat in your diet, you're getting dairy in your diet, those are highly absorptive of environmental chemicals because a lot of them like fat. And so they glom to the fat in animal milk and in animal fat. So make sure that you're getting those more quality organic. And then look, don't have the $4.50 organic peach, have the, 80-cent organic apple. And I strongly use and refer to the environmental working group in my medical practice and when I teach. So you can go to the environmental working group. It's just ewg.org. And you can look for a number of things. One, they have something called Dirty Dozen and Clean 15. The Dirty Dozen are the foods that if you can't afford to eat them organically, unless you're like at a wedding or a super special occasion and it's like the one-off thing that you do on the rare occasion, just avoid those. The Clean 15 are the ones that even when they're produced by conventional agriculture, you don't have to be too concerned about. So lean into those, avoid the Dirty Dozen and everything else in between. Pick and choose based on what you can afford. Except for meat and dairy, again, make that organic. And then they also have something called Skin Deep, which is a great resource where you can actually just for free search different body products. One of my family members gave me this beautiful set of lipsticks from an organic type company. And I was just curious. So I searched the lipsticks in the environmental working group. And even though the company brands itself as clean and green, they actually use a lot of heavy metals in their very dark pigmented lipstick. So someone had given me like a dark red and a dark brown. They were gorgeous, but they actually came out like on the scale of 1 to 10 on the EWG, 1 being the lowest and 10 being the highest. They were like 5, 6, and 7. So you can search for tens of thousands of products in there, which is really nice. And then you can use that when you have your baby so that you can be using cleaner baby shampoo and cleaner sunscreen and all the things.
Are there any particular supplements? What are your thoughts on a sort of conventional prenatal? Any supplements to support during pregnancy?
Yes. So even in preconception, I have basically my kind of rule is anyone who's having sex and could possibly get pregnant should be taking some form of folic acid. You can either take regular folic acid, 400 milligrams a day, or micrograms, or you can take methylfolate or a combination of the both if you're not sure about your MTHFR status and you want to make sure you're addressing that. So a prenatal vitamin will have that in it, and it kind of gives you the assurance that when you do get pregnant, you're already on the things that your baby will need. So neural tube development happens in the first trimester. So let's say you don't realize you're pregnant till 6 or 8 weeks in, you've missed a critical window of development. Not to be scary, most babies are still going to be fine, but why not already be on it? And I'm very supportive of women taking prenatal vitamins. And there's some data that does suggest that most prenatal vitamins have more than we need, but we also know that most American women are deficient or not getting quite enough of a whole host of nutrients that we would do better with if we were already, nourished fully when we got pregnant. And a prenatal vitamin kind of is like a little insurance policy that it bridges that gap. Vitamin D is another one. We don't get enough vitamin D in most prenatal vitamins. The ones that do have enough vitamin D, you often have to take like 8 capsules a day. And that's just, or 8 pills a day is so much for most pregnant women, especially when they're first trimester and nauseated. And then I am very pro essential fatty acids during pregnancy. And for women in the 3rd trimester, I know I'm getting a little ahead of myself. I usually do recommend a probiotic just because so many babies are born by C-section. Women are more likely to get antibiotics for group B strep or C-section during labor. So again, just to sort of give a little extra support to the microbiome. So my prenatal bundle is a prenatal vitamin, fish oil, omega 3, EPA, DHA, and vitamin D, and then later in pregnancy, a probiotic. It's pretty standard in my practice.
Yeah. I mean, I have what I call the essentials, which is multivitamin, fish oil, probiotic, and vitamin D.
Yeah.
That I just think everybody should be taking. Okay.
Basically.
So we get pregnant, and now what? Things to do, things to avoid.
Yeah. So there's a fairly conventional list of things to avoid, like raw fish and alcohol, although Emily Oster, who is an economist and very well written on the subject, does take issue with those things and say we're probably being overly cautious or it's unnecessary. I kind of still am a little bit old school about that.
Yeah.
Super hot saunas, there's like a sort of a list of the things to avoid. But for the most part, if you have a healthy lifestyle, you're exercising, moderately, you can continue most of the things that you were previously doing. Obviously, cigarette smoking, drug use, even cannabis use, I would put on hold while you're pregnant, especially, in general, I'd put on hold, but absolutely cannabis use through the 1st trimester and all the other things through the whole pregnancy, and preferentially cannabis use throughout pregnancy. That's a whole other conversation. And what else?
About coffee?
Coffee is an interesting one. So the data on coffee shows that really up to about 150 milligrams of caffeine a day is totally fine. And so I basically just say it's more about your energy. If you're needing coffee to get up in the morning, if you're needing coffee to get through your day, or you're needing coffee to have a bowel movement, let's look at why that is and not just skirt over that. But if you want the coffee because you love the coffee, then a cup of coffee or a green tea or black tea, you just need to be careful. Like Starbucks coffee tends to have way more caffeine in a typical cup. So just knowing what you're getting.
And it's not organic.
Right, that too. And there really hasn't been shown to be an increased risk of miscarriage at that level of coffee.
Okay.
Now, I will say there are some new studies coming out that are challenging that. So if you're concerned, you have a history of miscarriage, maybe don't drink coffee, especially in the 1st trimester. But overall, historically, it's been seemed to be fine.
There's just so much going on, particularly as you mentioned, there's so many more C-sections, and antibiotics being given. And, there's just, I'm sure, from taking a very detailed history, so many people, at least that came to see me, I'm sure it's the same with you, have this history of C-section, antibiotics right at birth. All this stuff is just really setting us up for, frankly, potential for long-term chronic illnesses. So,
and just difficult postpartum when you want to be enjoying that time and that you've got thrush or gut issues or.
So I'll talk about some of the things that I did with Elle, who people may know, is adopted. And then we can just kind of walk through those and see, do you agree? Do you disagree? What are your thoughts about it? So I knew that she was going to be a C-section baby. And so I asked the doctor if we could do seeding, and I'll let you go in and explain what that is. So she was seeded. We delayed her bath. She had vitamin K drops instead of the shot, and we did not do the hepatitis B shot. And then because she was adopted, obviously I wasn't breastfeeding, although there are ways to get women to breastfeed. I just didn't want to alter my body in that kind of way, and also didn't have the time. But there was a woman in Austin who had just been a surrogate and had a family in New York, and they were not wanting the breast milk. And so I met with her. tested her. She had a history of thyroid, so I tested her for her antibodies. She, of course, okayed all of this, and she was willing to go gluten-free because she had some history of that. So Elle was basically breastfed for the first year of her life, though it was through a surrogate. So, kind of your thoughts on those things that we did.
Okay, I love it. I love it. I love how much just thought you put into your little one.
And
too.
I had a birth plan.
So
I mean, even though it wasn't my birth, I had a birth plan and it was all typed up. And, I brought it to the hospital and asked the nurses to follow it. And she was in a very, very small hospital in a very small town in Wisconsin. And I thought, I'm going to have so much trouble here. These people are going to think I'm crazy. They're not going to do it. And I actually think it was the best thing that we were in a really small hospital because they abided is maybe not the right word. They were open to it. In fact, the clinical social worker at the end was pregnant. She came and asked me where I got the vitamin K drops. I mean, people were very interested in what I was doing. So it ended up being perfect. But yes, let's hear your thoughts on it all.
Okay. Seeding. Seeding is when you get a swab from the mom's vaginal fluids during labor or right at birth. And then you can do it in a number of ways. You can wash the baby's face, wash the baby's whole body, or actually enter some of the bacteria, some of the fluid into baby's mouth. And what is happening is you are inoculating the baby with the organisms that the baby would have gotten were she to pass through the birth canal, but bypassed because of the cesarean birth. I actually have an incredible podcast that your listeners can listen to on my podcast with a woman named Maria Gloria Dominguez Bello. And she is the one who pioneered and is continuing to pioneer all of the research on seeding. Now, what Maria has said is that it's not quite ready for prime time yet. However, people are doing it all over the country. And to my knowledge, there have not been any adverse effects. The important thing to know is that the mom doesn't have any sexually transmitted diseases or active group B strep or something that could be passed on to the baby through baby's eyes, mouth, or skin. And, so it's just something you want to make sure that you are really working in conjunction with your birth provider about, and that there's no infection that's developed in labor or in the amniotic fluid that's now passing through the vaginal flora, and making sure there's no stool contamination. Although interestingly, part of what baby's flora is when they're getting exposed is they're coming over the vagina, over the perineum, and there often is stool there. So, we're kind of getting a little bit of a natural fecal transplant at birth too, but make sure there's no active stool in the field. So I think it's great that you did that. I would encourage everyone to listen to the podcast on vaginal seeding, because I think she is the queen of it. She is literally the person who created this whole thing. And it'll give you a lot of information on baby's microbiome and the importance of the baby's microbiome. So that's phenomenal. Okay, you did.
And just to quickly, the studies, the ones that they have done, have shown that, those that have a C-section and don't have seeding are way more at risk of having atopia, atopic disease, autoimmunity, asthma, eczema, all of these things.
Later obesity.
Right. And those that got the seeding, their propensity to get these was, kind of equivalent to a vaginal birth. And so it's kind of like, short of the things that you mentioned, like, what's the downside? And
the downside is really just infection.
Of course. Yeah. Just what
Yeah. And we just don't know 100% because the studies are so new. We don't have studies on these kids as teenagers or adults yet. We will soon, as teenagers at least.
But hopefully this will just become the standard of care with a C-section.
I know. Okay. It makes so much sense, doesn't it? Okay. So you did vitamin D, you did vitamin K oral drops. Which actually, for my home birth clients over 20 years and my birthing clients in the patients in the hospital, those who preferred vitamin D oral drops, that's what I always did. What I would say is that the data, vitamin K, sorry, I keep saying D, vitamin K is used to prevent bleeding in newborns. Should there be any injuries at the birth, baby's clotting factors don't really come on fully until day 7 or day 8. So historically, over the past decades, we give babies vitamin K shots intramuscularly. Vitamin K drops are less protective than vitamin K intramuscularly. It still works, but just not as robustly. So if there was any trauma at the birth, bruising with forceps or vacuum extraction, something like that, where we know there's significant bruising, then I would actually do the vitamin K injections.
Okay.
But if everything looks okay, you know, you're on board with it, your pediatrician feels good about it. Ultimately it's your choice anyway. I think the vitamin K is a reasonable option.
And if I remember, this was 7 years ago now, it wasn't just I did it on the first day. I think I had to do it on maybe the first 3 or 5 days. I can't remember.
With the oral, you repeat it.
Yeah, right. Okay, yeah.
And you have to be able to get access to it. Not everybody keeps it, so you often have to order it. I had to order it ahead of time.
I ordered it ahead of time. I actually just got mine off of Amazon. I mean, it was a particular brand that, you know, they used in Europe. I mean, it was like Biotics or something, and it was a, you know, in a you know, oil-based drop. And, you know, I made sure to bring it closed, unopened, new, so that
company, like, be careful where you're getting it from. There's
absolutely,
and make sure it's kept under the right conditions.
Right. And I made sure that it was closed so that, you know, that they then felt comfortable using it, that it hadn't been tampered with. I didn't, you know, put something else in the bottle. I mean, all of these things. Okay. Delayed bath.
Newborns should not get a bath right away. I mean, yes, you can wipe blood and gunk off of them, but as far as the vernix goes, leave it on there, rub it in, have skin to skin. Don't do anything that's going to affect that inherent flora that the baby has gotten, especially if babies come through the vaginal canal and has gotten that good seeding from mom. That's really important. Babies have, as we all do, we have different colonization of different flora in different parts of our bodies. And that gets triggered by a vaginal birth and all those good microbes. So absolutely delayed bath.
If a woman can't breastfeed and maybe doesn't have access to breast milk in the way that I did, what's the next best thing?
I think some of the breast milk substitute formulas that are really done well, that are available now, which weren't available even a decade ago, really are fabulous. I prefer those over what I absolutely don't recommend. And I know this is controversial and you might get hate mail, and I apologize, but I don't recommend. I recommend, again, like the Western price.
Okay.
Homemade.
Well, you know, the thing is, I just have to, I know you tell the funny story. I made the Western price, you know, because anyway, it doesn't matter. I made that, and because we were unsure about the breast milk, whether we were going to be able to get it or not. And I mean, I can't tell you how many gallons or jars I made. Javier drives it up, you know, 2 days in the car in you know, making sure it's preserved and cold. We buy some refrigerator for the hotel room. I mean, this whole thing, I mean, it's absurd.
What we won't do.
And then I felt so uncomfortable. We got the breast milk, and then I just felt so uncomfortable about the raw milk, and I just didn't know. And the hospital did not want me doing that when they found out. So she got 1 or 2 bottles of that. And then here we were, just all this work, all this time, all this energy, and just down the drain, literally. So
yeah, I mean, baby formula is much more like a nutraceutical in the sense that it needs to be prepared with the proper ratios and nutrients that a baby's brain and body needs. And so I'm much more comfortable with products that we can buy in health food stores or online now. There are some really wonderful ones, and those have been formulated to meet your baby's needs. And then, of course, if baby is lactose intolerant or has other digestive issues, then you might need some special formula. But yeah, I'm all about the homemade-y. Like, I am Miss OG. Do it yourself. Baby's born at home. You know, cloth diapers, homemade baby food.
And you're feeling about, you know, these breast bank, not the breast bank, because they then pasteurize the milk, but, you know, their Facebook groups where you can buy people's milk.
As long as milk can be tested, as long as mom can be tested. Mm-hmm. So I had a mom in my medical practice, midwifery practice years ago. Sadly, she developed breast cancer, stage 4 breast cancer, which I actually identified while she was pregnant. And so she had to have a double mastectomy after the baby's born. She could not breastfeed. So I reached out to my midwifery clients who had all been tested for all, infectious disease and sexually transmitted infections, et cetera. And they were healthy. We knew their nutritional status, and we had a party, and people just came with coolers and milk, and it was really beautiful. So I'm all about it. Just know where you're getting your milk from.
Yeah, absolutely.
And same with the bank. I mean, the banks at least are testing it for you. And yes, it's pasteurized, so you will lose some of the beneficial aspects of it, but it's still a great option if you're not wanting to use formula.
Well, before we part ways, I like to ask all of our interviewees or guests, how you would encourage our listeners to take back their health. Just 3 ways that you would encourage them to start to take back their health today.
I would just say spend less time on social media, because social media creates so much compare and so much despair and so much dissatisfaction and so much stress. And if you're going to be on social media, seek out things that make you feel really good. Allow yourself to hit pause when you deeply need to, or even before you deeply need to. Really carve out times in your life that are just for you, where you can get quiet and nourish yourself, and spend time with people who make you laugh. I think that's really important.
Great. I love those. Very ones that we haven't heard yet. So that's awesome. And how can our listeners find you?
You can go to my website, avivaromm.com, where I have tons of free resources.
Do you want to spell that just for people who are listening?
Yep. AVIVAROMM. You can also go to Dr. Aviva Romm on Instagram. That's really me there, hanging out. And I would say those are the 2 best places to get started.
Well, great. Well,
I try to have a really positive Instagram feed.
Oh, good. Yes, no, I know you do. So yes, I could have continued a lot longer. I know you had a hard stop, so we'll have you back to finish up some of the things we weren't able to get to. But thank you so much for being here today, and thanks for everything that you do.
Oh, back at you.
I want to thank this week's guests for sharing their time and knowledge, and thank you for listening. To read the full show notes for each episode, which include a summary, timestamp, quotes, and any resources mentioned, please visit amymyersmd.com/podcast. Lastly, if you've enjoyed this episode, I'd love if you would leave a rating and a review on Apple or Spotify, and we'll select a few to read out loud in a future episode. Tune in next week to hear from another inspiring guest as we help you take back your health.